بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا ونبينا محمد وأهل بيته الطيبين الطاهرين. Ulama Kiram, lady scholars, brothers, sisters, people who hold various leadership posts within the Jamaat, invited guests, Assalamu alaikum wa rahmatullahi wa barakatuh. Initially this event, as I was told, was organized exclusively for the Mayyit committee because of the coronavirus crisis as to how to handle the dead body and things like that. But I think then they decided to invite other people who would be involved or who would be interested or who would be affected by the crisis. Before I go ahead, the best way to bless this gathering would be to start with a few verses of the Holy Quran. I would request Brother Samir Maher Shah to come and recite a few verses of the Holy Quran, please.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم إنا أنزلناه في ليلة القدر وما أدراك ما ليلة القدر ليلة القدر خير من 1000 شهر تنزل الملائكة والروح فيها بإذن ربهم من كل أمر سلام هي حتى مطلع الفجر صدق الله العلي العظيم.
Thank you, Brother Samir, for the verses of the Holy Quran. So I think there'll be two sections to this gathering. We'll be having professional advice from Dr. Ali Hussein Molu, followed by religious advice from Sayyid Adil, inshallah. So without wasting much of your time, you already started a bit late. So inshallah, I'll invite Dr. Ali Hussein Molu, please. The loud salawat ala Muhammad wa ali Muhammad.
Respected scholars, heads of various subcommittees, and brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Two things. One is, thank you for giving me the opportunity to share whatever little I've gathered on the ever-evolving coronavirus. And two, it's important to recognize they are senior medical professionals as well, members of the Central Medical Board, Dr. Mtula, our physician, Dr. Manji, Dr. Kamal himself. So wherever I fall short, I will request that you, help me out with further instructions. And of course, there is the religious aspect to it, where we have our religious scholars. I just present what the World Federation guidelines are, and then any questions related to the Islamic Sharia, I'm too juvenile to take them. So Sheikh will help us. Before I begin, this is actually my last slide, but the most important one. And that is what has happened over the course of a month or two, and especially after yesterday, is there is a lot of spread of information. Right information, wrong information, necessary information, unnecessary information. A lot of panic buying, a lot of hoarding, and that is all summarized in the WHO terminology as infodemic. And if you just Google infodemic, amongst the first lines you will see an infodemic is more dangerous sometimes than even a pandemic, because the consequences of lashing out information and creating panic and the subsequent reactions to those panic can be devastating to the community more than even the pandemic itself. Now, when it comes to the word pandemic, I think about a week and a half to 2 weeks ago, that's when the WHO recognized coronavirus as a pandemic. Some people might not know what is a pandemic, and this is a new thing. Pandemic creates more panic. However, you should realize that we have a lot of pandemics that are existing anyway. For example, HIV. HIV is a pandemic that has been existing since 1981 till today. It is a pandemic. Yellow fever at one time was a pandemic. The swine flu. These are all pandemics, and having the word pandemic is not green light to start panicking. We're living with pandemics anyways. Tanzania has a prevalence of 6 to 7%, if I'm not mistaken, of HIV. That's a pandemic, and that's across the globe. So it's really important to realize these terminologies and not take them as something that we've not understood and react based on just terminologies. We have pandemics, let us not create an infodemic. So I think a good amount of this presentation was done by Dr. Manji himself at the mosque. I will just quickly go through because during the mosque session maybe there was no chance of having question and answer sessions. But just to remind ourselves, quickly go through the guidelines that are set and then what we're dealing with, so that if there are any other questions that they can follow after the presentation is over. So simply, I'm not going to spend a lot of time in this. Coronavirus, the name comes from crown. The virus looks like a crown, and it causes usually mild to moderate and sometimes severe symptoms. They are related to the respiratory tract. The coronavirus outbreak that we have right now is related to the respiratory tract. That means anything to do from your nose going downwards to the lungs. We've had we've had severe disease expressed in SARS and the Middle Eastern respiratory syndrome as well, and now we have the coronavirus. So these things are not new. The media sometimes may make you feel that this is a new bomb on us, but we've had these things. This is what the world looks like right now. You can say essentially almost the whole globe has it. And when the presentation was done in the mosque during the Kushali, we were talking about travel and minimize travel, but now traveling essentially, even without travel, we already have the first case in Tanzania. So as of 17th March, we have more than 160 countries out of the 195 countries recognized by the WHO that are affected by the coronavirus. So essentially almost the whole globe. We have 180,000 infected cases, 7,000 deaths. Very important information. 80,000 have recovered. More than 50% of those sick have recovered. And we will see why recovered. Mortality rate, as by the WHO, CDC, the maximum they've gone to is 3%. And I think Dr. Mwanji stressed this in the mosque as well. We've battled a deadlier disease, the dengue fever. Yes, maybe not as contagious, but we have dealt with deadlier diseases than the corona. Again, more reason for us not to panic. How is it spread? Through aerosols, air droplets, simple moisture in your breathing, cough, contact. These are common ways where and I'm sure all of us have been reading about this, so we are familiar with how the virus spreads. Signs and symptoms, again, I'm not going to spend much time on this. The most common ones are fever, dry cough, fatigue. In severe cases, you might end up having difficulty in breathing, which will then require hospitalization and so on. It is important to note that some people will not be symptomatic at all. You will have the coronavirus and you'll not be sick at all. It is very possible. And you might have the coronavirus and you might have milder symptoms than the flu that you normally get from an allergy. So the symptoms vary. Like I said, in severe cases, it can lead to severe pneumonia that will require then hospitalization and ventilatory support. This is the summary of severity of cases. Very important slide. This should summarize why one should not panic. 80% of the cases are mild to moderate. 100 people have the coronavirus, 80 of them can be treated at home. Simple flu. In 13.8% of the cases, it's severe. Critical cases, 6.1%. Again, these are numbers we've dealt with worse. We've had worse outbreaks and diseases that we've had to deal with in the past. The mortality, so everybody's worried. People are dying, people are dying, people are dying. Yes, no doubt that 7,000 people dying is not a small number. But we need to look at the graph at which age people are most susceptible. Actually, below 10 years, there is no report of mortality, except for a newborn that was infected. But mortality rate below 10 years, no mortality. Then you see between 10 and 19, 0.2%. Almost negligible. 20 to 29 years, 0.2%. The same for 30 to 39. The mortality starts rising after 60. That's when now you start looking at things more critically. And you start looking at patients more critically. And you start looking at your household members more critically. The highest that it gets is 14.8% when the person is 8 years plus. So, does it affect young people? Some people think that, why are they shutting schools? Coronavirus has not killed anyone or has not affected the young person. That's not true. Coronavirus can affect anyone. Young, old, pregnant, immunocompromised, strong person, it can affect anyone. The severity of the case is different from age to age. We'll not go into the details of this, just clearing some myths. Some people think, if I go to Ibrahim Haji right now, I can get myself tested for corona. Or if I go to Aga Khan, they must be having some corona kits. That's not true. We do not have readily available kits as of today to test corona. So please do not go knocking at your doctor's door and telling them, I need to test for corona. We can't do that for you. The only people who have the mandate for testing are the Ministry of Health, and therefore all the hospitals have been given a strict guideline. When you have a patient, you are suspecting corona, the immediate action is to inform the ministry. And they will then do the test samples, not us. So please do not come to the hospital having flu and saying, I need to test for corona. That's not going to happen. When it comes to medication, a lot of discussion has been done. We should use these medicines, or today I was reading an article, some people are taking antibiotics to treat coronavirus. There is no known medication apart from supportive management, supportive treatment to treat the disease. There is no known medication, and that goes for a lot of the viruses. Vaccines, not yet. Today I saw a message spreading on the group, Israel has come up with the vaccine and now they're only keeping it to themselves, and that's not true. When you want to develop a vaccine, there is a long process that needs to be followed. People need to be tested on how the vaccine reacts. That takes months, and from the CDC report, they do not say they are going to have a vaccine less than 8 months from today. If we are going to come up with a super fast vaccine, it's going to be after 8 months, according to the CDC. So there is no vaccine. Do not go to the hospital asking for vaccines. We do not have vaccines. Of course, the treatment and vaccines are in development. Now, this is where you need to act as advocates to spread out the message. How can you protect yourself? The most effective way that has been pronounced by the WHO, CDC, and every other health organization that has given out guidelines is hand hygiene. Hand hygiene involves washing your hands thoroughly with soap and water. Unfortunately, we've made the craze of sanitizer so much that everybody's rushing to the market today to get a sanitizer. Yes, sanitizers are important to have, but remember that we have water and soap, and that has been recommended to be used. 20 seconds of vigorous and correct washing of the hand should do the job. So if we were thinking of gifting the elders sanitizers, they have access to water at home and soap. When they come in contact with anything, if they have a flu, they have a cough, or as and when required, they can simply wash their hands with soap and water. While having a cough or a sneeze, and that is hygiene even if it's not corona. Yeah? Simple. Use a tissue or the inside your elbow. The tissue needs to be disposed correctly. Do not use a tissue and then leave it in the bedroom or in a seat where you're sitting or in the bus. That's creating chances of spread. It needs to be disposed correctly. Maintain social distancing. Social distancing involves the hugging, the handshaking, the kissing, the simple distance that we are not used to maintaining. Especially with our culture, it's difficult to maintain that distance, but the recommended distance is 1 to 2 meters. General social distance. You go to the ATM you go to the ATM and want to withdraw money, have your social distancing. You are in a queue in a supermarket, have your social distancing. So social distancing is important. And again, an average human being touches their face, hand, eyes almost 30,000 times a day. But we need to stop that, especially during this outbreak. Avoid touching your eyes, nose, or mouth. Whether you're sick, whether you're not sick, whether you come in contact, do not touch your hands. You want to touch your hands, you want to touch your eyes, nose, or mouth with your hands, wash them. You want to eat, wash your hands. So I think this is God's way of telling us, we need to be more hygienic. Yeah? Another issue, wearing of masks. Today on the streets you can see some people already wearing masks. That is, according to the WHO, wearing a mask unnecessarily is unwarranted. You only wear a mask if you are taking care of a person with suspected coronavirus infection or you yourself are sneezing and coughing. That is the only reason why you should be owning a mask and not hoarding. Yeah? Surah Humaza talks about hoarding wealth. The mask is wealth today. So if we're going to be hoarding, we're accountable for that. You don't need a mask, please don't keep a box of masks at home. The healthcare workers need it more. Using a mask for healthcare workers or anybody who is in contact with a sick person, there has to be a method of using the mask. You're going to use a mask like any other person, even if there is an infection, you're going to contract it. There is a way of using a mask and disposing a mask. And I'll just quickly go through this because we will come to the Mayat committee, specifically the guidelines, and therefore the mask rules apply even then. Before you put a mask on, hand hygiene. Wash your hands thoroughly. Soap and water, sanitizer, preferably soap and water. You cover your mouth and nose with the mask and make sure there are no gaps between your face and the mask. What I mean to say is, you see people wearing the mask until here. That's wastage of mask. And I feel like you'll be accountable for that. Mask should cover your nose and mouth. And there should be no gaps between your face and the mask. Avoid the mask while avoid touching the mask while using it. You wear a mask and then you start adjusting the mask to your comfort. You're anyways contaminating it. Throw the mask away. It's useless. So avoid touching the mask when you're using it. And if you do touch the mask, you have an irritation or there's something and you need, immediately wash your hands again. This issue of using the mask for 2 weeks, the same mask, it's useless. Yeah. Once these disposable masks, I didn't come with samples. So he has the disposable mask. That's not how you wear the mask, by the way. So this 2-ply face mask that he's wearing, this is a disposable mask. You wear it, you use it, you throw it. You don't wear it for 2 weeks. Yeah? And there is a way of disposing it. You throw it in a proper bin and not just anywhere. Or don't leave it anywhere because that defeats the purpose. When you're removing the mask, you remove the mask from behind. So for example, he's worn the mask. You don't remove the mask from in front. It's supposed to be from behind, so you are not touching the surface that you feel has been contaminated. And once you throw the mask, hand hygiene again. The thing that we're forgetting a lot is hand hygiene, and that needs to be enforced. Okay, so I'll just clarify a few things. The myths that have been coming about. Is soap and water superior to hand sanitizer, or is hand sanitizer superior to soap and water? Depends on what's available. Both do the job. A sanitizer with at least 65 to 95% alcohol concentration is all right to be used. This is for us doctors who are coming frequently in touch with patients. It's for Mayat committee. It's not for just everybody. Buying the sanitizers and keeping them and using them when you feel like using them is hoarding. That's unacceptable. You have access to water and soap, use water and soap. Use water and soap, cleaning your hands thoroughly. If you just Google how to wash your hands by WHO, they will explain you. Because I would need a sink and, washing your hands involves the front parts of your hands, the back, in between the fingers, the nails. 20 seconds of good hand washing should do the job. You don't need to hand sanitize. Surprisingly, people are keeping sanitizers and they put the sanitizer on their palm and rub like this and they think they've done the job. That's not going to work. That's not sanitizers are for during the corona outbreak. Now, when it comes specifically to dealing with a patient and to the extreme a mayat that has been infected with the corona virus infection, there's guidelines that have been given by our Marja, Ayatollah Sistani. And we will just quickly read them, and I will show you a document that I just got hold of just before the lecture. So this is a very recent document by the World Federation. And of course, Syed will assist me in clarifying all these Islamic verdicts. My responsibility is just to present them here. So someone is asking question 10, would it be mustahab to close the eyes and mouth of a dead body that is infected with the coronavirus? If someone fears, you see, Ayatollah Sistani's rules are very general and it is to be taken case by case. If someone fears they will suffer harm, then what was wajib no longer remains obligatory. This is a general rule. And what was mustahab or makruh must be avoided. In cases other than these, the act can be performed. Anything that you feel will harm you, you are told to stay away from it. With reference to ruling, if performing ghusl on a dead body that has been infected with the coronavirus poses a risk for the person doing the washing, can tayammum be performed instead? Yes, if there is no means for performing ghusl without risk, then tayammum must be performed. Someone goes further. What if performing tayammum? If it is harmful to perform tayammum on a dead body, either with the hands of a person performing the tayammum or with the hands of the dead body, how would tayammum be performed? Here Ayatollah Sistani tells you, tayammum on a dead body must be performed by the hands of the one performing tayammum, and in case performing it without wearing gloves poses a risk, there is no problem in wearing gloves during the performance of tayammum. What if performance of tayammum is causing a risk for you? If there is a fear or harm in performing ghusl or tayammum, then the dead body must be buried without ghusl and tayammum. If it is not possible to apply wajib camphor to the dead body that is infected with the coronavirus, is it possible to leave it out? And is there any replacement act? In case of fear or harm, it is not required and there is no replacement. So what Ayatollah, from my understanding, what Ayatollah Sistani has done here is he's given a general basic rule. If you are in fear of harm or getting infected, then these wajib acts, these mustahab acts, all are kept aside and the safety of you and the community comes first. There's a lot of debate going around as to, is coronavirus that contagious that, if I take precaution, then why shouldn't I be able to do ghusl? There is a lot being studied still about the coronavirus. How long is the virus infectious after the dead body, after the person has died? Is it 12 hours? Is it 24 hours? Is it more than that? Is it 1 hour? Is it 2 hours? There is no medical research, and my seniors will correct me if I'm wrong. There is no medical research that is available of how long the virus is contagious from a dead body. We're still learning about it. And therefore, sorry, I just need to change laptops. Okay, so we're sorry we're not being able to connect the other laptop which has the, it's a very short statement that we want to present on the options that the World Federation have put into place. With regards to ghusl and kafan for a dead body, the World Federation in their document that we can of course share at a later time has given two options. Option 1, perform tayammum with minimum essential opening of the body bag. We will come to this body bag a little just after this. Kafan to be administered on top of the body bag, which should preferably be placed in a coffin. This option 1 should only be considered if the Ghusl Kafan committee is confident that they will be able to take all infection control precautions pre and post burial as recommended in the guidelines. During this process, adherence should be to only those acts that are wajib. Mustahab and other acts should be avoided. Hunut should only be performed on the forehead and the hands. In summary, ghusl is out of the table. In this World Federation document, tayammum is what can be done as a minimum. Bury, option 2. Bury the body without ghusl, tayammum or kafan. This option should be taken if the Ghusl Kafan committee is not confident that their center or community has the necessary resources or expertise to manage all the infection control measures. It is especially important to take this option where the law of the city or country prohibits the community or center from opening a body bag or even bringing it to the center. In Tanzania, alhamdulillah, and we hope it continues, we have not had a death on coronavirus. But in majority, if not all, in majority of the centers, communities, they are forced to abide by the law of the country, the government. And when we call the ministry, any hospital calls the ministry that we have a suspected corona case in our center, what the ministry will do is come and take a blood sample, test. If it is positive, they won't leave the patient with you. They are going to take the patient with them to their designated centers. The ministry has allocated designated centers for the treatment of coronavirus patients. And therefore, in that unfortunate circumstance, when a patient will pass away because of the coronavirus, we are yet to find out, will we get the body from the government? That is very important to note. So while we are discussing about the Ghusl Kafan protective measures, getting the body in itself is a question. And a lot of countries, the governments will not return the bodies because of the chance of contamination and infecting other people in the community. What the government will do is follow their procedures of burial or cremation. In some countries it's cremation, as per their guidelines, the health guidelines in their facility. In case we do get the body back of a dead person, then we have these two options, which I have mentioned. Personally, this is again my personal opinion. At Dar es Salaam Jamaat, with good PPE, personal protective equipment, which I will discuss about, if we are able to establish this, then probably we can sit with Sheikh and he can guide us on option 1. But if we can't get there, then there will be no option but to stick with option 2. Right? So, what is PPE? PPE is your personal protective equipment, and this does not only necessarily deal with your immediately kafan and ghusl. Someone passes away at home. God forbid, if there is a huge outbreak in Dar es Salaam, Tanzania, and deaths are happening, for example, at home. How do we approach that dead body? Can we just approach it like how we approach any other body? Number 1. Number 2, should these principles only apply to corona? Or should these principles apply to any body that we are not sure of the cause of death, number one, or we are not sure about the status of the body. What diseases or what conditions did that body have? So personal protective equipment is not meant for corona only. And this is my advice to the Ghusl and Kafan committee. PPE is not specified only for corona. We should be having PPEs, a thorough PPE, at any time. At any time, these precautions need to be taken. So what is the PPE? Of course, I can share these slides. I think they're not very clear here. This is the Public Health of England. They have defined the PPE as follows. Before you wear a PPE, again, hand hygiene. Like you will see hand hygiene come everywhere. Hand hygiene is not only by a sanitizer, water and soap. Perform hand hygiene before putting on a PPE. You have to put on a long-sleeved, fluid-repellent disposable gown. I don't know, maybe the Mayat committee can share with us the gowns that we are using right now, the overalls. You are using raincoats. Are these disposable? Okay, so there is a method of disinfecting it, which I will brief. But then, if it's possible to get disposable gowns, overalls, better get them, right? Number two, respirator. What's the difference between a respirator and a mask? The mask is what he showed you. There is a specific mask called N95. It is a mask that has a membrane or a filter that prevents infection passage. If we are dealing with infectious dead bodies, then the recommended mask to be used is not that mask. It's the N95. I can share the sample later on with the... Unfortunately, these masks have become extremely expensive today. Eye protection. We should have eye protection. Goggles. Disposable goggles. Some are disposable. Some goggles which we can use time and again, they just need to be disinfected properly. Eye protection is very necessary, especially when ghusl is being given or when we are dealing with a body that has body fluids around, because you don't know at what point in time a splash can get to your eye. Gloves. Gloves, again, there is a way of wearing gloves. Wearing your overall until here and then your glove coming until here and exposing a bit of your hand, that's not wearing gloves thoroughly. The glove is supposed to come, look at the arrow pointing there, it is supposed to come on top of the overall. That is very important. So minimum, at least our PPE should have this. Your gown, preferably disposable, your respirator, your mask, your goggles for eye protection, and your gloves. These are minimum. Yeah, other PPEs go to the extent of head cover. You see when they were dealing with Ebola, they have the head cover. But this should be minimum, at least this, when dealing with a dead body. Again, size. Let's not get the PPEs and then we are oversized or undersized for them. They should have a good coverage, right? How do you remove the PPE or how do you disinfect the PPE? Again, that has a method. Once you are done with your ghusl or you have done dealing with the dead body, and then immediately with your gloves you start touching yourself, you're just contaminating yourself. First, your gloves. Go from the outside and disposed of. That is very important. After disposing of the gloves, hand hygiene. Wash your hands thoroughly, minimum 20 seconds with soap and water or hand sanitizer. Then the gown. If you have the disposable gowns, they have the tying of the knot on the back or on the waist. You need to open the gowns and remove it inside out and not pull it and throw it. There should be minimum, in short, when removing the gown, there should be minimum contact between the front of the gown and your hands. And once you come in contact with the gown, don't touch your face, eyes, and anywhere around your nose especially, without cleaning of your hands. Your eye protection then, your mask, as I explained how they need to be removed, and finally, again, hand hygiene. So my recommendation to the Mayat committee is the minimum PPE should be there, especially during this time. Because again, we do not know what every Mayat what disease every mayat has. And sometimes these precautions should be taken for any and everybody. We are not sure what is the status of the mayat. For those who will be approaching patients, those who will be approaching sick patients, those who will be approaching dead bodies, these personal protective equipment must be in place. How to wear them, how to dispose them, all guidelines need to be followed. Again, after this presentation, we can't go into a lot of details. We will share these documents, and you could go through them individually. And yeah, lastly, coming back to my first slide, the ministry has constantly been saying, let us not panic. Let us not panic, and let us not create panic for others. It's not fair, especially for the elders, especially for those of us forwarding messages that we are not sure of. This is causing panic and more distress than probably even the disease itself. Right? Just because we have a lot of access to social media today, then we head for the plague. The plague killed 200 to 300 million people. But at that time, there was no social media. So there was no rumors and, being extra careful. That was not there then. With coronavirus, I'm not saying we don't need to be careful. We need to take precaution, definitely. But from my presentation, you see that there is no reason to panic. And the less we panic, the more caution we will take. If you're going to go and rush into a supermarket full of people and one of them has an infection, you are more at risk because of panic buying rather than sitting at home or visiting your centers less frequently. You are less likely to get corona at home than going to a supermarket to buy ration. Yeah. So panic buying, hoarding, this is unacceptable, and we should not be doing this, especially in this state when we know, alhamdulillah, our community is blessed. We have people ranging from high class people to middle class. There is the majority of the population cannot afford a sanitizer. Majority of the population cannot afford a face mask. So let's not hoard. There will be a time where people will need this face mask, really. And we have kept them in our doors when we don't really need them. Let's not do that. With that, I come to the end of my presentation. I hope I was able to share some insight.
Thank you, Dr. Al-Hussein Molu, for this an informative presentation. Please keep your questions ready. We'll be having a small question answer session after Sayyid Adil's presentation. Sayyid Adil, please. Loud salawat ala Muhammad wa ali Muhammad.
Assalamu alaikum wa rahmatullah. बिस्मिल्लाह रहमान रहीम। बहुत बहुत शुक्रिया डॉक्टर साहब का, मैयत कमेटी का, और आप लोग यहाँ पर आ गए सुनने के लिए। तो कोई चीज़ बाकी नहीं रही है अल्हम्दुलिल्लाह। डॉक्टर साहब हैज़ एक्सप्लेन्ड वेरी कंप्लीट मैसेज इज़ देयर, एवरीथिंग हैज़ बीन कवर्ड आई थिंक। लेकिन एक चीज़ जो उन्होंने ज़्यादातर इंसिस्ट किया है वो पैनिक ना होने के लिए। वाक़ईन ऐसे ही है। कभी कभार बीमारी से ज़्यादा बीमारी का डर, बीमारी का फ़ियर इंसान को मार देता है। तो कोशिश करें इंशाल्लाह पैनिक ना हो। अभी वो मैसेजेस में देख रहा था तो हमारी एक ग्रुप है टीचर्स की, माज में मदरसतुल ज़हरा में, उन्होंने एक मैसेज भेजा था किसी टीचर ने कि कोरोना को हम किस तरह एलाबरेट कर सकते हैं। अगर लिखेंगे अरबी को कोरोना तो किस तरह उसको हम एलाबरेट करेंगे वर्ड बाय लेटर। तो एक अच्छा मैसेज है, मैं इसको पढ़ देता हूँ, आपकी बात समझ में आ जाएगी इंशाल्लाह। कोरोना विल स्टार्ट फ्रॉम द काफ ऑफ द अरबिक लेटर। काफ मीन्स कुल्लु नफ्सिन दायक़तुल मौत। दिस डेथ इज़ देयर। तो रेशियो अगर आपने देखा है वहाँ पर प्रोग्रेस में प्रेजेंटेशन में 80+ पर ज़्यादा इफ़ेक्ट हो रहा है। तो फिर 80+ तो ऑलरेडी लोग जा रहे होते हैं, तो हम लोग थोड़ा उनको जल्दी भेज देते हैं। कोरोना वायरस हेल्प करता है, हमें थोड़ा जल्दी भेज देता है। तो आज जो बात हो रही थी हमारे टीचर्स के दरमियान, लोग गले मिलते हैं, ख़ुसूसन लेडीज़ में ज़्यादा है। कोई ज़ियारत से आ गए तो लेट अस हग ईच अदर, शेक हैंड, और उनको किसिंग करना और बरकत मिलेगी ज़ियारत की। तो उनसे जब कहा जाता है कि ऐसा मत करो तो वो कहते हैं ये हमारी मोहब्बत है। it is our love, we are hugging each other, they are coming from the ziyarat. تو میں نے ان سے کہا یہ بھی کہہ دو بھی فاتحہ پڑھنا بھی تو محبت ہے. اینڈ جو ہے فاتحہ جو پڑھا جاتا ہے وہ بھی ون آف دی سائن آف دی لو ہے. گلے ملیں گے تو پھر فاتحہ بھی پڑھنا پڑے گا بعد میں. تو تھوڑا اوائڈ کریں ہائیجینک جو چیزیں ہیں. لیکن موت تو ہے, ڈیفینیٹلی موت از دیر, کل نفس ذائقۃ الموت. اور یہ بھی میں بتا دوں, ایک لطیفہ جوک بن گیا آج کلاس میں, جب میں سینئر سٹیزن کو پڑھا رہا تھا تو میں گائیڈز دے رہا تھا, ان کو ایڈوائز کر رہا تھا یہ کرنا چاہیے, یہ کرنا چاہیے. تو کسی ہماری بہن نے ہاتھ اٹھا کر کہا مولانا ہم نے ول پریپیئر کر لیا ہے, وی آلریڈی پریپیئرڈ دا ول, کمپلیٹ دا ول, ول از دیر ان اور ہینڈ. یہ بھی کبھی کبھار یہ چیزیں جگاتی ہیں انسان کو, اویئرنیس اور اویکننگ کے لیے بھی یہ چیزیں کام آتی ہیں. تو کاف اسٹینڈس فار کل نفس ذائقۃ الموت, اینڈ دین واو ومل حیات دنیا الا متاع الغرور. جتنا ہم دنیا میں ہیں, یہ دنیا کی زندگی کچھ بھی نہیں ہے, جسٹ سیکنڈس ہیں یا منٹس ہیں. اور انسان اس میں زیادہ تر اروگینٹ ہو جاتا ہے, وہ سمجھتا ہے یہ میری زندگی ہے, میری چیزیں میرے ہاتھ میں ہیں. ایٹ دا اینڈ نتھنگ ول ریمین ان آور ہینڈ. تیسرا لیٹر ہے را, ربنا ولا تحمل علینا ما لا طاقت لنا بہ. ہم یہاں پر دعا کا موقع ہے کہ ہم اللہ کی بارگاہ میں دعا کریں, پروردگار وہ بیماری ہمیں نہ دیں جس بیماری کو ہم اٹھا نہیں سکتے, وہ مشکل ہماری زندگی میں نہ ہو جو مشکل کو ہم بیئر نہیں کر سکتے. انبیئریبل ڈیسیزز, انبیئریبل پرابلمس, ہمیں نہیں معلوم کہاں سے بیماری آئے گی, کس طرف سے آئے گی, ہمیں نہیں معلوم ہے. اللہ کی بارگاہ میں دعا کریں گے کہ اتنی ہی ہمارے پاس پریشانی ہو جتنا ہم اٹھا سکتے ہیں, اس سے زیادہ پتہ نہیں ہے. کرونا وائرس بھی تقریباً پینک کا بنا کرنا نہیں چاہتا, لیکن پتہ نہیں ہے کہاں سے, کدھر سے, کس رخ سے انسان کے پاس آ جائے. تو انشاءاللہ اللہ کی بارگاہ میں دعا کریں گے کہ پروردگار ہمیں اس بلاؤں سے دور رکھے. ان ساری چیزوں کے ساتھ ساتھ the another letter is the واو stands for وَاصْبِرْ لِحُكْمِ رَبِّكَ بِأَنَّكَ أَعْيُنَنَا. At the end, the message of patience is there, tolerance is there, steadfastness is there. ساری بلاؤں میں, مصیبتوں میں انسان کے جو چیز زیادہ کام آتی ہے وہ صبر ہے. انبیاء کی زندگی کا مطالعہ کریں, اہل بیت کی زندگی کا مطالعہ کریں. کبھی یہ اس کو کنورٹ نہ کریں بلا ہے, مصیبت ہے, عذاب, پنشمنٹ ہے. یہ ساری چیزوں کو اپنے ذہنوں سے نکالیں. کبھی کبھار یہ چیزیں آتی ہیں ایک ٹیسٹ کے لیے بھی, ٹرائلز کے لیے بھی. تو یہاں پر جو سب سے بڑی چیز ہوتی ہے وہ صبر ہے. کوئی ممکن ہے ریلیٹیوز میں خدا نخواستہ اس دنیا سے چلے جائیں, جس سے ہم زیادہ چاہتے تھے وہ اس دنیا سے چلے جائیں. ایٹ دا اینڈ صبر ہے. اللہ پر شکایت نہ کریں, کمپلینٹس نہ کریں, یہ خدایا یہ کیا ہو گیا, خدایا وہ کیا ہو گیا. انشاءاللہ ایکسیپٹ کریں ان ساری چیزوں کو. انشاءاللہ اللہ تبارک و تعالی ہماری مدد کرے گا. The next letter is نون, نحن قدرنا بینکم الموت وما نحن بمسبوقین. موت آ جاتی ہے تو آپ ویکسین بنائیں یا نہ بنائیں, آ گئی تو پھر آ ہی گئی ہے. کسی کے لیے موت نہ جلدی آئے گی, کسی کے لیے نہ موت ڈیلے ہوگی. آنا ہے تو وہ آئے گی, وہ آ کے رہے گی. کوئی انسان کا اختیار وہاں پر نہیں چلتا. کتنے لوگ ہیں جو دوڑ کر گئے, بھاگ کر گئے, بچ گئے, وہ جا کر مر گئے. جو مرنے والے تھے وہ بچ گئے. کتنے لوگ ہوتے ہیں ہاسپٹلس جاتے ہیں, بیماری ہے, سیریس پیشنٹ ہے, لیکن وہ باہر آ جاتے ہیں. جو چلتا پھرتا ویل پہ بھاگتا ہو, دوڑتا ہو آدمی جم میں گر کے مر جاتا ہے. تو موت ہمارے اختیار میں نہیں ہے, لیکن کوشش کرنا ہمارے پاس ہے, پروٹیکٹ کرنا, بچانا اپنے کام میں ہے. کہتے ہیں ایک شخص آیا, ٹائم ہے ہمارے پاس 2 منٹ, تو اچھا سن رہے ہیں تو مجھے خواہش مائک کے سامنے کھڑے ہونے کے بعد تھوڑا دل چاہتا کچھ بولیں. تو ایک شخص آیا حضرت سلیمان کے پاس, کہ حضرت سلیمان سے اس نے کہا کہ یا نبی اللہ, صبح سے ایک فرشتہ میرے پیچھے پڑا ہوا ہے, مجھ سے ملنا چاہتا ہے, تو آپ میری مدد کیجئے کہ میں کہیں دور چلا جاؤں. تو حضرت سلیمان نے پوچھا کہاں جانا چاہتے ہو. اس زمانے میں سٹوریز میں لکھا ہوا ہے. تو اس شخص نے کہا مجھے ہوا کو حکم دیجئے, میں انڈیا چلا جاؤں, اس وقت ہند. تو حضرت سلیمان کی حکومت تھی ہوا پر, ایئر پر. تو آپ نے حکم دیا اس کو اٹھا کے لے جاؤ, انڈیا میں چھوڑ دو. تھوڑی دیر کے بعد وہ جو اینجل تھا, فرشتہ, وہ آیا سلیمان کے پاس. اس نے کہا یا نبی اللہ آپ کا بہت بہت شکریہ, ویل تھینک فل ٹو یو. تو حضرت سلیمان نے, میں نے کیا کیا, تمہارے لیے میں نے کیا کیا ہے. تو اینجل نے کہا, جو موت کا اینجل تھا, ملک الموت, اس نے کہا اللہ نے حکم دیا تھا میں اس بندے کی روح انڈیا میں قبض کروں. لیکن وہ ایجپٹ میں تھا تو میں پریشان تھا. حکم انڈیا میں لینے کا ہے تو میں ایجپٹ میں ابھی بندہ مارکیٹ میں گھوم رہا ہے, تو ابھی میں اس کی روح قبض کر کے آپ کے پاس آ رہا ہوں. وہ خود اپنے پیروں وہاں تک پہنچ گیا, وہ اس دنیا سے چلا گیا. کبھی کبھار انسان کوشش کرتا ہے کہ چلے جانے کے لیے ہم امریکہ چلے جائیں, UK چلے جائیں, وہاں جا کر بس جائیں. ہمارے پاس روایتوں میں ہے جہاں پر مصیبت آتی ہے وہیں پر رہو, کہیں جانے کی ضرورت نہیں ہے. انشاءاللہ اللہ تبارک و تعالیٰ کوئی نہ کوئی راستہ نجات کا انسان کے لیے نکالتا ہے. اور آخر میں دا لاسٹ لیٹر از الف, استغفروا ربکم انہ کان غفارا. کبھی کبھار یہ بیماریاں, یہ ٹرائلز, یہ پریشانیاں انسان کو جگانے کے لیے ہیں. انسان اپنے آپ کی طرف سوچے, گھر میں رہے گا 1 مہینہ, گھر میں رہے گا 25 دن 30 دن, ایک انالائز کرنے کے لیے, اسسمنٹ کرنے کے لیے, اپنے آپ کا خیال کرنے کے لیے میں نے اپنے لیے کیا کیا ہے, کتنے گناہ میرے ہیں, کتنے خطائیں میرے پاس ہیں, کتنے سنس ہیں. 1 تسبیح 2 تسبیح 3 تسبیح بچوں کے ساتھ بیٹھ کر انسان اللہ کی بارگاہ میں معافی مانگے. اللہ تبارک و تعالیٰ نہ تنہا معاف کرتا ہے تو بلکہ اسے ایک اور نجات کے راستے, سالویشن کے جو ویز ہیں, اللہ تبارک و تعالیٰ اسے شو کرے گا. ایک میسیج تھا جس کو پڑھنا تھا, میں نے آپ کی خدمت میں پڑھ لیا ہے. تو گھبرائیے نہیں, یہ موت کے جو احکام ہیں اٹ از ناٹ کنسرن ٹو ایوری باڈی کہ سارے لوگ موت کے مسائل جانیں, یہ ضروری نہیں ہے. میت کمیٹی از دیر, جماعت ہے, انشاءاللہ وہ لوگ کیئر کریں گے, ٹیک کیئر کریں گے. جیسے ہمارے پریسیڈنٹ صاحب نے ایک اچھا جملہ کہا تھا, پتہ نہیں ڈاکٹر صاحب اس کے بارے میں سوچ سکتے ہیں کہ اگر جہاں پر سینٹرز ہیں گورنمنٹ کے, یہاں پر جو میڈیکل سینٹرز ہیں جو کرونا وائرس کے لیے انہوں نے الاٹ کیا ہوا ہے, وہاں پر جا کر بات کی جا سکتی ہے, ڈاکٹر سے مشورہ لیا جا سکتا ہے. وہاں پر ایک ایسا فیسلٹیز فراہم کر سکتے ہیں کہ وہیں پر غسل دیا جائے, پیک کرنے سے پہلے باڈی کو اگر کر سکتے ہیں پائپ کے ذریعے سے غسل دے سکتے ہیں, وہیں پر کفن پہنا دیا جائے اور وہیں پر جو ہے وہ باڈی کو سیل کر دیا جائے. یہ بھی ایک طریقہ ہے. اگرچہ پیسہ خرچ بھی ہو تو پیسہ خرچ کرنا پڑے گا, ایون پیسہ خرچ کرنا پڑے, سہم امام خرچ کرنا پڑے, تو یہاں پر ہماری اجازت ہے کہ وی کین اسپینڈ دا منی, پرووائڈ کریں گے فیسلٹیز کو. انشاءاللہ گھبرائیے نہیں, کوشش ایٹ دا اینڈ لاسٹ مومنٹ تک بھی کوشش کریں گے. اگر نہیں ہو سکا تو ہمیں قانون کو فالو کرنا ضروری ہوتا ہے. اسٹیپ بائی اسٹیپ وی کین فالو دی لاس آف گورنمنٹ اینڈ دا شریعہ بوتھ. انشاءاللہ ہمارے ڈاکٹرس ہمارے پاس ہیں, نرسز ہمارے پاس ہیں, کمیٹی ہمارے پاس ہے, ڈرنے کی ضرورت نہیں ہے. یہ احکام جو ہے میت کے کیسے تیمم دینا ہے, کس طرح کرنا چاہیے, بتانے سے سمجھ میں نہیں آتے ہیں. سوری ٹو سے دیٹ. اب جتنا بھی آپ کلیئر امیج بتا دیں وہ سمجھ میں نہیں آئیں گے جب تک انوالو نہیں ہوں گے. اکثر چیزیں شاید میت کمیٹی والوں کے لیے آسان ہے کیونکہ وہ آلریڈی یہ کام کر رہے ہیں تو ان کے لیے چیزیں آسان ہیں. 50% آف دا تھنگس ایزی فار دیم. جب تک انوالو نہیں ہوں گے اس وقت تک کوئی مسئلہ وجود میں نہیں آئے گا. پینک نہ ہو, کوئی نہیں مرے گا انشاءاللہ. اگر کوئی مر بھی جاتا ہے تو انشاءاللہ وی آر دیر ود دا کمیونٹی. انشاءاللہ میسیج ان کو اطمینان کا دلائیے, کہیں ہماری ماں بہنیں, ہمارے مومنین بھائی بہن پریشان نہ ہو جائیں, مر جائیں تو کفن نہیں ملے. ابھی سے اسی سوچ کر جو ہے مرنے کی خواہش نہ کریں, زندہ رہنے کی تمنا کریں. انشاءاللہ اللہ تبارک و تعالی ہم سب کی زندگی کو طولانی فرمائے. کوئی کوشچن ہے تو میں آپ کے پاس ہوں. ایک جو سوال ابھی میں آ رہا تھا تو کیا تھا کسی نوجوان نے, وہ سینیٹائرس کے بارے میں جو یوز کرتے ہیں ہم لوگ, اس میں الکوہل ہوتا ہے. الکوہل نجس ہے تو ہم نماز پڑھ سکتے ہیں یا نہیں پڑھ سکتے. الکوہل میں تو آیت اللہ سیستانی کا فتویٰ یہ ہے کہ یہ الکوہل جو ہے وہ پاک ہے, پیور ہے, کلین ہے. ہم اس کے ساتھ نماز بھی پڑھ سکتے ہیں, اس کو لگا بھی سکتے ہیں. وضو کے بعد ہی وی کین یوز دس الکوہل. لیکن کنزمپشن حرام ہے, لیکن وی کین یوز فار دا کلینلینس اینڈ فار دا پریئرس. تو یہ تو پیور ہے اور کلین ہے انشاءاللہ. ایک سینیٹائزرس کے بارے میں ہے جو عام طور سے مسجد کے دروازے پہ لگا ہوا ہے. پہلے تو سمجھتے تھے کوئی فرشتہ آ کے بولے گا, تو اب تو وہ عسکری کہہ رہا ہے, پہلے وہ سینیٹر پہلے اشارہ کرتا ہے, تو سب کو جانا پڑتا ہے, وہ ہاتھ اپنے صاف کر کے اندر جانا پڑتا ہے. چلیے الحمدللہ یہ بھی ایک طریقہ ہے لوگوں کو جگانے کا. کوئی سوال ہو تو پوچھ لیجئے گا. الحمدللہ ڈاکٹر سے ڈن دا گڈ جاب. تھینک یو ویری مچ ڈاکٹر, جزاکم اللہ. السلام علیکم ورحمۃ اللہ وبرکاتہ.
Ahsant Maulana Sahab. I'll request Doctor to take the stage.
So this is a sample of the overall that is usually used. So this is ideally supposed to be discarded. after use. However, if you are getting a material that has to be, you can't discard because of the availability. These are not available, very difficult to get them. If you're making a material that can be washed, then there's a process of decontamination. Once we are done with the ghusl or kafan or approaching the dead body, then this needs to be put in a gallon or a bucket which chlorinated solution, like bleach, the household bleach, the 5%, I think that's the concentration. They explain how to concentrate it. It needs to be in there for some time, and then after taking it out, after the decontamination process, this needs to be washed with soap and water, and then can be used again. The type of mask that we were talking about, the N95 mask, this is the mask. You will see it is labeled here as N95. So this is the mask that is preferably to be used by healthcare professionals and those in direct contact with the very sick and the dead bodies. This is the preferred mask. It is, when we were saying that there should be no place between your face and the mask, this creates a very good barrier between the outside and your face. Yeah. The two-ply face mask, you can clearly see there's a lot of places where you can get contaminated. With this, it's used for TB, in TB clinics, not only corona, and any other outbreak that will ever happen, God forbid. These masks are the ones that are preferred to use. Not by everybody again. If everybody goes and purchases these masks, we will have a problem. We will suffer. Maybe if there is any questions that we can take. Yes.
Sorry, just apparently the reports according to the global leaders and everyone say that someone who suffers from mild symptoms, they are advised to stay at home rather than going to the hospital or going out for it. So what's your advice in terms of, do we have to, is there an urgency to go to test, or do you have to rather stay home, isolate yourself from other people? And secondly, how do you isolate from others around your house, around the inside house? Do you have to stay in a separate room? What are the etiquettes of that?
Yeah. So that's a very good question. There was some message circulating that anybody who has gone to ziyarat should self-quarantine themselves at home for 14 days and not go out. There is a method of quarantining yourself. Being at home and quarantining yourself from the public and getting in contact with your family members is worse actually. You are affecting your family members immediately. So when you say self-quarantine, that means you will avoid contact with anyone, including your family members. For someone who is not symptomatic but has a history of travel to those countries, the WHO says they should self-quarantine. That's the guideline. But unfortunately, now that we have it in Tanzania, and we don't know what the progression of the disease is, if you have the symptoms and you do not require hospitalization, then you will need to self-quarantine yourself at home for 14 days. Self-quarantine is self-quarantine, not self plus family quarantine. Yeah, it's self-quarantine. You will not be able to get in touch with even your family members. And the advice is, it's very difficult. We are not used to these things. But staying away from your family members, even when it comes to your meals, in your prayers, that is what's advised. You should be on your own as much as possible so that to avoid contaminating others. If you do not have symptoms, you are not fitting in the case definition of saying someone is suspected of coronavirus. You have not traveled to a hotspot, which is Iran, Italy, and you are in Tanzania. We've not had any cases reported in Dar es Salaam. There's no need to self-quarantine yourself. You don't have to self-quarantine. The closing of the schools and probably the other institutions is a measure to stop contact, but it's not quarantine. We don't have to, from today, all of us go home and close ourselves. That's not what's the situation, right? We're not on lockdown. So self-quarantine, I hope I've answered your question. Self-quarantine is self-quarantine. That means you do not get in touch with your mother, with your father, with your wife or your husband, your siblings. That's self-quarantine, right? Unless someone else wants to add, any of the doctors, Dr. Amtullah maybe. Any other questions? Yes.
Is it possible for somebody who has recovered from this virus to get reinfected?
So we've been reading studies, we've been reading case incidents that have been reported. Today we saw a case report from a person in Japan who was infected, recovered, and again got sick and tested positive. How authentic is this information? I saw it on one of the news channels online. Very important thing to learn, to understand, is that we as scientists, as doctors, as the WHO, as the CDC, we are all still learning about the disease. There is a lot yet to be learned. So such questions of why are we not developing immunity, is there someone who is totally immune to corona, we don't have answers yet to those. But there are case reports of people testing positive from a reinfection. Okay? There was a question that was raised before I started the presentation, that is it possible that someone doesn't have symptoms of the coronavirus and can still infect others? What if someone came from Iran, for example, does not have any symptoms, but is later found out to be corona positive? Could have he infected? Yes, we said in our presentation, you could have the coronavirus and be asymptomatic and have no symptoms at all, or very mild symptoms that you might have thought is, you probably drank something cold and caught a flu, but you're actually having corona and you're infecting others. So again, to your question, when you say that if I'm having a flu, should I go to the hospital? Yes, go to the hospital. But on your way to the hospital, please don't go like how we normally go and contaminate every other place. Yeah, make sure it's a simple visit. Actually, the lady from the reports, the lady who landed in Tanzania, and the moment she got her symptoms, she immediately rushed to the hospital, taking these measures of making sure not to contaminate others as soon as she started her symptoms, and immediately declared herself that she is suspecting to have coronavirus. So we should all be responsible in that way, right? Go to the hospital. There is a triage protocol in every hospital. At Ibrahim Haji, there is a triage protocol that has been set. I'm sure in every other hospital, there is a way of preventing infection to others. There is a certain protocol. Follow the protocols, cooperate. There is no question of discrimination right now. You have some people who think that they are discriminating me, telling me to wear a mask. If I go to the hospital, you have flu like symptoms, they give you a mask to wear. And you're like, why? I didn't go travel anywhere. Why do they give me a mask? These are all precautions that we are taking to safeguard ourselves, to safeguard other people in the community. Right? Okay. Yes.
For us, when we are handling the dead body,
Yes.
4 stages. First is collection.
Yes.
Second is ghusl. Third is kafan, and fourth is burial. Would you suggest, what would be suggestion that on the ghusl, obviously we are taking precautions, but collection, kafan, and burial, we never do any protection. What
Yes.
would be suggestion?
So basically, amidst this outbreak, every stage should have precautions. But generally, when we are dealing with dead bodies, at least minimum, these processes of collecting the dead body, I know when we are putting the body down into the grave, you can't have full PPEs on. It becomes difficult. In this situation, if you cannot do it, it has to be in its bag and it needs to be disinfected. But if you're handling a normal body and you want to take precaution, then at least the minimum should be there, the mask, the gloves. That should be there. I don't know, maybe Sheikh can clarify if there's anything against having while the body is being brought down. Yeah. And that's why you see the World Federation document says, if you are not confident that you are going to stay away from, you're going to be able to protect yourself. If you are not confident that you're going to protect yourself and there's a chance of you getting contaminated, option 2, right? For this particular disease. Okay. Any other questions? Yes, you had a question.
So, you mentioned that when somebody passes away from the hospital, if there is a death in the hospital, you inform the government and they look after them. They take care of whatever has to be done. There is a protocol there. What about if somebody passes away at home? What happens then?
Okay.
What is the protocol?
Okay, so here are a few things. One is, not necessarily a death happens, then we inform the ministry. If you come with a flu and you are even stable, flu, you don't need to be hospitalized, you are stable, If a doctor is suspicious that you are fitting in the case definition of a coronavirus infected person, we are responsible and liable to inform the ministry. That is our responsibility by law. And they have their reasons why they have asked us to do so, which are very obvious. So we will inform the ministry as soon as we have a suspected case. No one tests corona apart from the ministry. So they will come and do the test and advise us accordingly and take the person if he is positive. Death will happen in their centers. If a person comes and is severe and dies immediately and we were suspecting corona, we will have to inform them and they will have to take the responsibility. Right? If a death happens at home, we follow these procedures. Of course, the death needs to be certified by a doctor. Right? At the end of the day, our doctor has to say this patient is dead. And that doctor is responsible to find out or get close to the cause of death. If they suspect that this patient had corona, they are responsible to inform the ministry. We should always remember that, like Ayatollah Sistani has informed us, respect the law of your country, right? To avoid contamination of others. Yeah. Okay. Maybe any final question or two before I hand over? Yes, please.
In the last definition of yours, how would the doctors know that the dead body was close with the corona?
Okay, so again, there are guidelines to define a person to be having corona. And so, for example, the case definition that exists right now, a suspected case is someone who has traveled to a corona-hit country plus having respiratory symptoms. So, of course, I will come to the family and ask the family, how did this person die? Did he develop difficulty in breathing and then die? Did he have a recent travel? Did he come in contact with anyone who recently traveled? So we cannot put our stamp and say this person had corona and died, but there is a definition of a suspected case of a coronavirus infection. I hope I've answered your question.
Yeah, but I think there should be awareness to guide our merit committee as well. Because if any other doctors goes there, maybe a normal doctor, and he is satisfied, gives a death certificate. You see, maybe not aware of anything. We know how our local administration, how they work on it.
So maybe that is a protocol that the Mayat committee needs to look into when receiving a call from home of a person passing away. Maybe during these times, this should not be taken lightly and just go pick up the body and go for or come to Ibrahim Haji and bring the body, and then we find out then that this person might have passed away because of corona. So yes, maybe you can interrupt. Yeah.
I would like to make a small clarification. So there are certain diseases that will kill you instantly. If I have a heart attack in 5 minutes, I'm gone. Corona is not like that. So it will be very, very surprising for someone to have corona symptoms to stay, because death in corona occurs if you are going to follow a severe course. Death in corona will occur at about day 7 to day 10. So I still can't understand how someone can have symptoms and be at home for 7 days and not seek medical attention and then die. Corona is not that kind of disease that you get fever today and 5 minutes later you are gone. So it can happen, yes, that scenario can happen, that someone with corona dies at home. But I find it a little bit far-fetched to understand if someone is having fever and cough and running nose, then they fall, they've lost breathing difficulty and are still keeping him at home. It doesn't follow the natural order. So most of these deaths, by virtue of the way that they become severe, you will be obliged to seek some medical attention. This is how these deaths are. Of course, if in the event this happens at home, treat it like a contact who is at home or a suspect who is at home. Okay, the first thing is the relatives who are in the house, if the corona death has happened there or if the corona suspect is there, let the relative wear a mask. Right? If it is a suspect, give the suspect a mask. And then inform the authority. Okay? I really still can't see that scenario whereby a corona death can happen at home. Because these symptoms, they tend to get worse over time. And if they are getting worse by day 10 or day 7 or day 10, and they have still not sought for help, either this person is homeless, or maybe lives alone, and there is no way of. So this would be a very extreme scenario. It would not be the routine. So that's the
Okay. Okay, maybe take one last question and then we close. It's 9, I think. Yes.
So, in the community, especially, we have extremes also who are not agreeing to these things, for example. You have guidelines here, like people tell us that we are still don't do this. Imam Shekani, as Molana explained. In these cases, what is our duty, number one? Number two, do we have some hotline, like to call somebody, to guide, to coach, or no? It's, we find that something is needed and we need that
Okay, just thank you for those questions. For some people, it is still very difficult to digest. The haram is closed, the mehfils are closed. It's very difficult to digest, and that is bound to happen with the affiliations we have with these, sanctuaries. But then, the reason why we're having this presentation to this group today is so that you act as advocates to the outside. Because you are leaders of a specific committee or you work with people of a specific committee, the intention is for you to act as advocates. The disease is real. We are not denying that Allah is there to protect us and the Imam is there, but the disease is real. We've seen it. We have it now. So anyone who is trying to be stubborn, you will have to help speak to them or counsel them as to why we're doing certain things in, of course, a very polite or diplomatic way. Or the other alternative is there is a group that has been formed by the Jamaat, a group of medical and non-medical professionals, which is taking care of this outbreak in case it does happen. I think maybe Jamaat are having a meeting today or sometime and will update us on what is the protocol to follow. But where you feel you should involve someone who can help you take care of a scenario to prevent an outbreak, you are responsible. You are responsible. Letting it go and taking it lightly can cause more harm than expected. Yeah. Okay. With that, I come to the end. Just one message. Again, I repeat what I said. We all have families, we all have people we work with. These messages, these important points will not reach if we don't act as advocates. I don't need to be the only one giving the lecture. The Ministry of Health should not be the only one giving these points. Try to instill calm in your families. Try to instill calm among community members rather than panicking and going out of your way to make sure you are safe and forget the rest of the community. That should really stop. We work together, and inshallah we've beaten worse, we will beat this too. Yeah, sure.
Thank you, Dr. Molu. Maulana Sahib has already left. He had to leave a bit early. So inshallah we'll thank him in the mosque. So just concluding remarks for this session. I was just listening to Agha Panahian just before I came. Most of you must have seen the clip already. So he says, throughout our lives, every Friday we hear, Usikum ya ibadallah, wa usi nafsi bi taqwallah. We hear taqwa, taqwa, taqwa. He says, Corona is a good time to understand taqwa in its true sense. Taqwa is nothing but vigilance, muraqabah, being vigilant, taking care of yourself. So this is what Corona teaches us. We just need to be more attentive to who we meet, how we meet, what are we doing with our lives, how do we take care of ourselves. And he says Corona is just the physical body, but taqwa is being 1,000 times more vigilant for your soul. So taking these concluding remarks, secondly, Ayatollah Khamenei, I was just wondering, a week back, he gave a statement that people who have lost their lives assisting Corona patients are considered to be martyrs. So the doctors, the nurses, I think the Ghusl committee also. So this is a time to serve, of course, with care. If you have the proper facilities, it's as much as it's time to isolate. People are scared, they would want to isolate, but it's also a good time to serve. So we should take it as an opportunity for ourselves to serve. At the same time, take a big lesson. Corona is a small thing, but taqwa is a bigger message, inshallah. So if you have understood nothing from this session, at least we should be willing to serve and take a bigger picture of taqwa, inshallah. Thank you for listening. Thank you for being very patient. Thank you to the speakers, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.